Women in perimenopause and those women struggling with PCOS can often benefit from microdoses of GLP-1 agonist medications. I am Dr. Alexandra Gajer. I am a board certified physician and specialist in metabolic and hormone health. The GLP-1 agonists such as Ozempic, Mounjaro, Zepbound, Wegovy, they've really changed the face of caring for people who are struggling with weight. But there are new applications of these drugs that are really exciting that my hormonal ladies are benefiting from. I work with a lot of ladies who are in perimenopause, which is that time period before menopause truly hits. It can start anywhere from the age of about 35 to the mid 40s. But there's a period of hormonal transition where things are a little bit wild in between a woman's reproductive years and the time when she stops having menstrual cycles. And women with PCOS also have some hormone derangements with irregular cycles and infertility. And both of these groups of women often struggle with weight. And a lot of them intuitively sort of know that their weight is related to their hormones. They may be doing everything right, but the weight is still somewhat sticky. And the hormonal issues themselves, when we check hormones in women, we are often looking at estrogen, progesterone, and testosterone. And sometimes we can balance those hormones, but women will still have trouble with weight and still won't feel as well as they want to. So the micro doses of the GLP-1 medications are very low doses that are lower than the ones clinically used for diabetes and for weight management. And they have been found to be really effective in this group of women. And the reason for that is that those other hormones that we talked about, estrogen, progesterone, testosterone, that affect vitality and energy and sleep and exercise recovery, those are highly influenced by another hormone that we don't think about as often, which is insulin. So insulin is the main hormone that drives our metabolic health. And this is sort of the tip of the iceberg in hormone health is estrogen, testosterone, progesterone. But underneath that, there's this whole fragment of metabolic health that's actually driving a lot of what those other hormones are doing. So women can have derangements to their metabolic health, and that can manifest as PCOS or more symptoms of perimenopause. And I found that when we put women on a micro dose of the GLP-1 agonist, again, Ozempic, Wegovy, Mounjaro, Zepbound, the generic names are Tirzepatide and Semaglutide, that their insulin sensitivity improves. Women with PCOS might start getting regular cycles. They will lose weight. They will stop having that overabundance of androgens or male hormones, and their estrogen and progesterone will balance out. And women who are in perimenopause also, they'll find that weight comes off, of course, not as quickly as at the full doses of these medications, but metabolic balance is restored, and the things that women are doing to maintain their weight actually start working. There's less of that resistance. And women often report less brain fog, less inflammation when they do this, as well as more energy and just feeling better. So research is just emerging about using these medications at micro doses, at very small doses. The benefit of this is that there's potentially far less side effects, less risks, and although we don't get that precipitous loss of weight, that quick weight loss, weight does come off over time in a very healthy way, and hormones can really benefit from this.